Is extremely high HDL beneficial or harmful? Too much of something good can be harmful, so goes the saying. Is this true in case of high density lipoprotein cholesterol, HDL also? HDL represents reverse cholesterol transport and is considered a marker of cardiovascular protection. But this view was challenged partly by a large study involving 631,762 individuals using big data approach. It was an observational study using CAN-HEART dataset which had 17 different individual level data sources. Study population had an age range of 40 to 105 years. They were residents of Ontario, Canada without previous heart disease or other severe diseases. Average follow-up period was 4.9 years in this study. Those with lower HDL levels were likely to have low incomes, unhealthy lifestyles, a higher blood triglyceride, a type of fat levels, and other risk factors for heart disease and associated medical illness. Low HDL levels were associated with higher risk of death due to heart disease, cancer, and other causes. The interesting finding was that those with higher HDL levels, above 70 mg per deciliter in males and more than 90 mg per deciliter in females, had increased hazard for death due to causes other than heart disease. This has been called the U-curve in case of HDL, with higher risk at low levels as well as extremely high levels. Another important observation is that low HDL levels are associated with poor general health and unhealthy lifestyle. An earlier study from Finland among male smokers had also noted the U-shaped dose response in men aged 60 years or more for death due to all causes. There was a view that increased HDL in that study was due to increased alcohol intake. The EPO Japan study had 43,407 individuals followed up for 12.1 years. Extremely high HDL in this study was defined as HDL levels of 90 mg per deciliter or more. Extremely high levels of HDL were associated with increased death due to heart disease with a hazard ratio of 2.37. Risk of extremely high HDL was more evident among current drinkers. Similar results were reported by other studies with tens of thousands of participants as well. Though most of these studies showed a negative role for extremely high HDL, there is a recent study from Korea which showed that extremely high HDL was not associated with increased risk of death due to heart attack and stroke. That study with 343,687 subjects also defined extremely high HDL as 90 mg per deciliter or more. The median follow-up period was 6 years. So to conclude, the final word on extremely high HDL is still not available. We need large-scale population studies of longer period across multiple countries to see whether the U-shaped dose-response relationship noted in several studies is actually due to HDL or some other associated confounding factors. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.